Hello, I'm Dr. Sundari Mase, Sonoma County's health officer. I'm here to share the latest updates in coronavirus in our county with you. Here's my report on cases as of yesterday, July 26. We now have 2,570 confirmed cases, up 104 cases over the weekend. 1,109 are active, and 1,437 have recovered. We now have 24 deaths, and we have had no change in that in the last 24 hours. We've done over 71,000 coronavirus tests, with 267 of those in the last 24 hours. The rate of positive cases is 6%, up from last week's percentage, and this reflects a 7-day average. Our case rate is 151.9 per 100,000, which is 51.9 cases above the state's threshold. I want to recognize that these are really trying times for us. It's hard to thrive when there's so much unknown ahead of us. But we do know that the key to our recovery is you, the community, and doing the right thing. Each of us really must strictly follow safety precautions, all of the mitigation measures every day until we are out of this dangerous time. On that note, I want to talk about something very important that we found from our data over the last month. We have found that gatherings are contributing to COVID-19 transmission in Sonoma County. We've seen a rapid increase in COVID-19 cases over the past week. Just in the last 72 hours, we have had 167 new positive cases. New positive cases aren't tied yet at this time to any single activity or sector. We're working on getting that data to see if cases are specifically linked to certain activities or sectors. But we do know that the new cases have been traced to households, travel, close contacts, and community transmission. In fact, 14% of 611 cases reported between June 21st and July 11th were associated with gatherings, including 4th of July barbecues with friends and family, birthday parties, Father's Day events, bridal showers, funerals, etc. These are events where people are gathering, perhaps with extended family or friends, and not just household members. For the safety of our community, please avoid gatherings with those outside of your immediate household. Remember to do the following anytime you leave your home. Stay at least 6 feet away from anyone not living in your household. This is social or physical distancing. Clean and wipe commonly used surfaces, doorknobs, tables. Wear a face covering in any public place. Bring hand sanitizer with you. Wash your hands frequently for 20 seconds at a time. If you feel sick, stay home and call your doctor if you think you need to be tested for COVID. And get tested either way. Even if you're well, this is a good time for you to make an appointment with OptumServe in Santa Rosa or Petaluma to get a test. Given how the situation is changing and how much depends on individual actions to stop the spread, I can't predict how long this health emergency will last. Not knowing what will happen every time we go out at minimum does try our patience. It can also create anxiety and stress. If you're feeling overwhelmed and need help, professional support is just a phone call away. You can call the County of Sonoma Warm Line 7 days a week from 10 a.m. to 7 p.m. The number is 707-565-2652. You can also find this under mental health resources on our website at socoemergency.org. English, Spanish, and other languages are also available. Asking for help when needed, taking care of yourself is a sign of strength. So please do give a call to the Warm Line. If there's one thing I've learned about people in Sonoma County since I got here, we know how to find strength to face the challenges. Together, united in our efforts to reverse the spread, we can and will cope with this virus. We'll use our strength to move towards recovery. That said, before we close today, I want to answer a question from a community member. When we look at the testing numbers, how many are repeat tests? Our epidemiologists do not track who in the community has more than one test. However, we do require that certain congregate living facilities where high-risk individuals reside, that would be our skilled nursing facilities, our residential care facilities for the elderly, board and care homes, they do conduct tests among their staff and residents on a rotating schedule so that 100% of these individuals are tested each month. All other healthcare facilities and providers must follow the guidelines pertinent to their area of practice and setting. Details can be found on our website. It is true that robust testing is a key component of the multi-pronged strategy for reducing community spread. As we work locally with our partners to build our testing and lab processing capacity in the face of national and state shortages, it remains imperative that people adopt all of the mitigation measures that we just discussed to protect themselves and the community. Take care, everyone. Talk with you again soon in 2 days.